Hi, I'm Helen Bauer, and this is the Heart of Hospice Podcast. The Heart of Hospice Podcast is your source for compassionate and informative discussions about hospice and end-of-life care. I'm a certified hospice and palliative care nurse with over 15 years of experience. Whether you're a caregiver, someone with a serious illness, or you simply need to know more about hospice care, this podcast is for you. Join me as we explore all the aspects of hospice, from the details of caregiving to the emotional and spiritual dimensions of end-of-life journeys. For more resources and to connect with me, visit theheartofhospice.com and find us on Facebook, Instagram, and LinkedIn. Keep listening for today's episode.
This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
This episode is sponsored by Hospice Navigation Services. When you need information about hospice, Hospice Navigation Services can help. Our team of experienced hospice navigators is here to offer one-on-one consulting sessions by phone or video. You can book a complimentary 30-minute session when you need general information, or book a 60-minute session when you have in-depth questions or need to troubleshoot your current hospice care. It's your journey. Hospice Navigation Services can be your guide. Visit theheartofhospice.com to schedule your hospice navigation session today.
My guest today is hospice nurse and end-of-life doula Carrie Oram, and she's teaching me about using sound bathing and clinical aromatherapy at the end of life. Carrie Oram is a dedicated, certified hospice and palliative care nurse with 26 years of experience in providing compassionate care to individuals and their families. She's also a certified sound practitioner, Reiki master, and a clinical aromatherapist. Carrie combines her extensive nursing expertise with her holistic certifications to restore balance to her patients' minds, bodies, and spirits. Her approach to care is centered on the belief that healing goes beyond just the physical. So in our conversation today, Carrie shares the methods that she uses to help patients in very unique ways: sound baths and other sound experiences, and aromatherapy. She provided several examples of how sound baths benefit patients, including patients who are dealing with neurodegenerative diseases. She's a certified clinical aromatherapist, and Carrie explained how she integrates aromatherapy into the care of patients at the end of life and the advantages of using aromatherapy as part of the plan of care. Carrie shared a lot of stories of her work with her patients, and you can connect with her in the work she's doing at Angel Heart Holistics, and the website is angelheartholistics.com. So keep listening. There's a lot to learn. Carrie, welcome to the Heart of Hospice Podcast. I'm so glad to have you with me, another hospice nurse to talk to.
Oh, thank you. I appreciate you. Glad to be here.
It's going to be awesome. I've been looking forward to this interview. So just to get to know you a little bit, I'm going to ask you a question that doesn't have anything to do with death or dying or grief or advanced care planning.
Oh.
We can talk about other things. I don't usually, but we can. So my question is, what is your favorite part of your day? Where do you have a special ritual in your day?
Definitely the morning, because I'm a morning girl. So I get up, I have an actual playlist that I play of music, and I get ready and I go to the gym. And I do that because nothing gets in the way of my day. Work can't call me, kids can't do whatever, and I just get to go to the gym and just do something for myself. So definitely the morning.
Oh, I like that. I like that. I will go to the gym in the morning if I have to, but a lot of times I'm having to drag myself out to do that one. But that's great self-care.
I'm the 5 a.m. club.
That's awesome.
Up and gone.
Okay. You are a certified hospice and palliative care RN. You are an end-of-life doula, so you've got the best of both. Tell me about the work that you're doing as a doula and how you blend this in, how you came to incorporate doula work into your hospice work that you were already doing as a nurse.
Okay. I actually started looking at being a doula back in 2017 before COVID. And honestly, I've had a hard time trying to figure out how to pair the two because they're totally different, RN assessments, medical, and doula is non-medical. So it's been the past year that I've been working with a company that recognizes doulas and nurses. So how I have incorporated that part of it is adding in the holistics of the Reiki and the sound and the aromatherapy. That's really how I pulled that into the doula. If I go out and do a doula visit, it's the non-medical. So it's just turning off that part of my brain, changing the hat, whatever you want to say, and just going in with that, just focusing on the family for that psychosocial, emotional part of end of life.
Very nice. Do you find that challenging sometimes? Do you find those
Yes.
roles blend and the line gets a little blurry?
It does, because if you start, you're there talking about end of life, and although in the doula programs, depending on where you go, you do learn about disease process, and you learn about the morphine and the lorazepam. You're not allowed to give advice on it.
Right.
So then you're sitting there and somebody's asking you and you're like, there is that line, definitely.
Yeah. And nurses are so inclined to teach because I think that's probably 80% of what we do is educate our patients and families.
Mm-hmm.
So for you to have this piece of knowledge and not say it because that's outside your scope at the moment,
Right.
that sounds like a challenge to me. That would be hard.
It is. And the way we've kind of figured, like what we do is I'll go out as like a end of life visit as a nurse, and then kind of incorporate them both, really. But I keep them separate, if that makes sense.
Yeah.
Yeah.
And for my listeners who don't really know about the roles, so because a nurse is licensed and a doula is not, that's where we get into you have to make sure you're staying in your lane. It's important that a doula who has nursing skills doesn't work outside of what a doula's role is because they're not functioning under a license at that point. It's a little bit confusing, but those of you who are licensed who are listening will understand that. So we're going to be talking about these extra therapies and interventions that you bring in to the care of your patients. Reiki is one, aromatherapy, sound baths. And I'm very interested in this because I've not had somebody who's worked with aromatherapy on the show before.
Oh, yay.
So I think there's a lot of content here that we can talk about. So let's just start with sound baths.
Okay.
Sound bath, what is that? How do you incorporate it into the care of a patient? How does that work?
Okay. So, and there's two different types. So what I've been doing lately, the sound baths are go to an assisted living or a SNF, a skilled nursing facility. And I bring my bowls. I use Tibetan bowls. I can use crystal, like whatever, crystal bowls, whatever. And we set up, there's another doula and I, we go together and set the bowls up at the front of wherever they set it up. And then either the patients come in on with their wheelchair, or they walk in and we have chairs and they just sit down. And so the sound of the bowls, the frequencies then are played, and just go out to the patients, however that is. It's amazing. Within a minute or two, you see them closing their eyes or they just look more relaxed. So I also do sessions as a doula with the bowls privately with a patient too. So I do both. The baths are just really, I guess, it's just it surprised me because I do regular sound baths, with people with different ages, not just geriatrics, and they lay down. So they lay down with a pillow and for 45 minutes, I play my bowls and then they get up and they leave. You can't do that with the geriatric population like that. So we had to accommodate and figure out how to do that. I also will take the bowls out to each of the patients. I love to get the bowls in their hands, especially degenerative diseases like dementia, senile degeneration, because I have seen people who have not talked talk.
Really?
So, yeah, put it in their hand and I'll just hit it with a mallet and their face, they just go, oh. We had a 99-year-old patient. She was sitting up front, had hearing aids, and she was just loving it. Just you could see in her face just lighting up. I went over to her, I put the bowl, it's my hand one. I played it, put it all around her head, and she just looked at me and she went, amazing. I mean, it's just priceless.
So when a patient or a client holds a sound bowl, it doesn't dampen the vibrations. They can feel it
No.
vibrate.
Funny story. Yes, I've had to figure out how to get their hands the right way, or a lot of them have arthritis, or so we're always
Right.
just reacting to what's going on. So what happens is the one doula will stand there and help hold the bowl up, and if you just put it in one hand, you got to make sure they don't have rings. If they have rings, that sets it off. So yeah, just hold it in the hand and you can just feel it right up. And I love to ask, how far up can you feel it? Because sometimes if there's some sort of cellular trauma or anything like that, it'll stop. And if I'm okay with stories,
Yes,
is that
please.
okay? Yeah, okay. So I had dementia patients all sitting around a table. We went to a memory unit and was going around the room, putting it in their hand, and they're smiling, all this. And I came up to this woman, we put it in her hand, and I hit it, and she just kept like looking at me like, we're like, can you feel that? And she's like, no. And I'm like, okay, tried it again. And so all of a sudden I got this thought. I'm like, oh, sometimes people will not get out of their head, right? And so I said, do me a favor, think of something, and I want you to go to your heart, right? And again, you're talking to somebody with dementia, so I'm not even knowing if this is gonna work or not. Hit it again, and all of a sudden she went, oh,
And
right?
she could feel it.
She could feel it. And I said to her, can you let me know what you thought about to have that happen? And she goes, I thought about my husband. And then we found out her husband had passed away a couple months before that. So again, that's the priceless. Like you can't make that stuff up, right?
Yeah, this is why we keep doing what we do.
Definitely.
For those moments.
Each time there's just always, and it fills my heart to see somebody have a moment of not worrying and just relaxing and just being calm.
I love it. Why the word sound bath? Why do they call it that?
Yeah, so the research that I have done is, if you think about it, it's like taking a bath and the water's coming down and bathing you. So the sound is coming and bathing your body with the frequencies.
Flows over you.
Flows through. Yeah.
Oh, I love that imagery. That's really cool. Okay, so the benefits. Obviously the vibration and the tone, if that's the right word, it resonates with people, no pun intended.
Yes.
But it connects. We know that with neurodegenerative diseases, music is oftentimes something that reaches in when other types of communication can't. What other benefits can somebody receive if they're experiencing a sound bath?
Happiness, just the other day I was again working on somebody with senile degeneration, and when I got all done, I was playing the bowl by her feet, and I asked her, I'm like, how did that feel? And she said, comfort.
Comfort. Yeah.
Comfort. Just that there are so many things that I could tell you that it does, but in I don't know if this is appropriate to say, but like in our world, FDA and all this kind of stuff, we're not allowed to say this stuff, right? So that's why I'm there to help them relax. Whatever else happens is beautiful. I was working on another woman just 2 weeks ago, Alzheimer's, speaks Spanish, doesn't really talk, and playing the bowls around her. She just kept staring at me, and all of a sudden she goes, "Me gusta." And I don't know if you speak Spanish. That's I like,
Oh, nice.
right? And so it's just, yeah. I mean, it decreases anxiety. It works on the parasympathetic and the sympathetic. It's I always say, like, you think about the nervous system and you think about there's the endocannabinoid system, which, if you don't know, the CBDs work on that one. You have the meridian, which acupuncture works with. All of that through your body, that sound is just
It's just flowing.
I hate to use the word penetrating, but
Soaking.
flows,
Yeah, it soaks in.
soaking.
So it's
Yeah, and
physiological, it's emotional, it's mental. And when you think about the whole person, body, mind, spirit, you can't separate one or affect one without affecting the other. So that's really a beautiful effect, and with something so simple. So when you're providing the sound bath, when you're creating the tones and providing these interventions, how does that affect you?
well, I love doing it because it doesn't just go forward, it also comes back,
Yeah, because it's
right?
just really flowing around and through the whole room, isn't it?
Yeah. And also I love being able, again, this is where that nurse part of me comes in. I love watching their reactions. And in my schooling, I was taught a lot of times the sound or any sort of toxicity or anything will kind of come out your fingers or your feet or whatever. And so I love watching their hands and seeing what's just going on the inside that's releasing.
Yeah, the
So
relaxation and the anxiety release.
back to that 99-year-old, that's, and the 100-year-olds and all these people, all this generation, what generation are they?
The greatest generation, is that right?
The greatest generation.
Yeah.
These people that were so hardworking, just did whatever they needed to do, just to see them enjoy something that has been around for centuries, but really wasn't put into their lives.
Yeah.
Right.
And it transcends age, transcends language, transcends mobility and abilities.
Mm-hmm.
Yeah,
Yeah.
I like that.
One other quick story was a gentleman who came into the sound bath, didn't know what was going on because I like to go over it a little bit at the beginning, but he sat down and he came in at the time where I was going around with the bowls, and I looked at him and I said, can I put this in your hand? And he's like, yeah. And I put it in his hand. I hit it one time. He looks at me and he goes, was it the sound or the vibration that turned off the thoughts in my head?
Oh, wow.
In a matter of seconds. So that's something that it can do too.
Yeah.
Yeah. He came back every time. He was like my greatest fan.
I love it. We're going to break for just a minute. This isn't the end of the episode. There's more to come, so stay connected.
This episode is being sponsored by Hospice Navigation Services. Hospice Navigation Services can provide the answers and support you need, whether you're seeking information for yourself, a loved one, or someone in your care. Our experienced team offers personalized, unbiased guidance through one-on-one consulting sessions by phone or video, tailored to your unique situation. Let us help you navigate hospice care with confidence and compassion. If you're a healthcare professional, Hospice Navigation Services is your trusted resource for you and your clients, providing compassionate, knowledgeable support at every step. When clients or families have questions about hospice, or if you need expert guidance to support your clients' end-of-life care decisions, we encourage you to refer them to Hospice Navigation Services. So whether you're exploring how to start hospice services or need to troubleshoot your current hospice care, Hospice Navigation Services is ready to guide you. You deserve clarity and compassionate support on this journey. Visit hospicenavigation.com to schedule your hospice navigation session today.
So I want to talk about the aromatherapy. You hold a certification in clinical aromatherapy.
I do.
What does that look like? What kind of education did you have? What kind of training did you take for that?
It was supposed to be 5 classes that we went to, but that was right before COVID. So it ended up turning into a 2-year education, and a lot of it on Zoom.
Right.
But the difference between a clinical certified aromatherapist is we are trained to work in the hospitals.
Okay.
So it's more on the policies and procedures and being prepared if there's an interaction. And again, going back to that, we're not going to state claims of we are going to take anxiety away. What we're going to do is reduce and make calm. That's really what the difference is.
Okay. So aromatherapy, how does it benefit your patients?
I'm going to go back to the fact that traditional medications, one of the things traditional medications can't pass through the blood-brain barrier. I don't know do we need to explain that or?
Yeah, can you go into some detail? Because I know I have some listeners that are not clinicians, and for the rest of us, it's a good reminder.
Yeah, so you have this barrier in your brain, right, that protects your brain, which is the life of us, right? And medications stop. The blood-brain barrier stops certain medications. I believe that's why they have a hard time with Alzheimer's trying to find an actual, medication or something to just totally make it go away. But aromatherapy is able to pass the blood-brain barrier.
So with this advantage, the blood-brain barrier, we know it allows some things in, but for everyone, aroma is allowed in, the sense of smell. So it's super impactful when it comes to providing care because it's a very unique tool that can be used on everybody. How do you integrate aromatherapy into the care of a hospice patient, somebody who's at end of life?
So we keep the oils that we use to a minimum for the clinical reason. So we use lavender, a wild orange. I use frankincense, red mandarin, just specific oils. Lavender is just soothing, calming. Wild orange we use for uplifting for those Alzheimer's and dementia. A lot of times we'll use those and have them smell that or have it diffusing while they're trying to feed them to help them stimulate their appetite. And one of my favorite blends is lavender and frankincense. As a hospice nurse, we have these end-of-life medications that are so important. And that's what I love about aromatherapy because it's a complementary therapy.
Right.
We do not want to stop using things that we know work. But sometimes in some situations, there's a point where the medications are working, the family's there, and everybody's just kind of looking at like, what do we do next, right? And so there are some blends that you can use that are known to help with transition. So that is lavender and frankincense together, and I'll have the family put it in some lotion and put it on their hands and also their feet. And then that comes back to the fact of just involving that family member if they're wanting to.
So it's inhaled, right? You're putting the scent out into the room, but it can also be put into something that's applied to the skin so that the aroma comes from that too. Nice.
Yep. And the feet are the best way to get the oils into the body if you're not ingesting them, which we don't do that. As clinicians, we don't tell people to ingest them.
Are there any patients that should not have aromatherapy? Is there anybody that it's contraindicated for?
Um, I mean, guess if you get in a cellular level, lavender, um, I, I, I don't know if it inhibits it, has something to do with the clotting factor.
Hmm.
Um, but I think, end of life, we kind of are not thinking of that,
Yeah, some of
you
those things
know.
are not as much of a priority.
Yeah.
But like something like a respiratory patient, somebody with COPD or
Oh,
emphysema, are those, is aromatherapy an irritant at all?
not that I have seen.
Okay.
Not that I have seen. There's a lot of oils that are so good for respiratory.
I like I mean, eucalyptus is one, right? Eucalyptus
Mhm.
is one.
Yeah. Ravis sartan. There's a lot that are I'll actually not on the hospice clinical side, but on my private side, I'll actually have them use them, put them in their hand. And I like to have them use them right before their inhalers. Again, complementary. We're
Hmm.
not taking away the inhaler, but why don't we use something that will maybe potentiate and help?
Right, right. Relax, help you take a deeper breath so that your medication's more
Mhm.
effective. Yeah, I like that.
Yeah. Yeah.
So let's switch gears and go back to the sound bathing because I'm really fascinated by that. Um,
Okay.
I have participated in a meditation class where they incorporated the bowls, and it really is a very unique thing, very unique
Mhm.
experience. Tell me about a time that you use sound bathing to support hospice staff, because that is one of the things that you do.
So, I always invite the nurses of the patients that I'm working on to be there when I'm doing the sound baths at the house, right? Just the sound therapy, I should say, at the house, or the CNA or whoever is there, because that way, there's that bond with the sound, and they're there too. Um, I will also offer um, the employees to come in and have their own private sound sessions to help them calm, relieve, the anxiety. Because, hospice nurses, we take on a lot sometimes.
Right.
Um, and that's what we do. They'll come in and have their own sessions.
Well, it's a great form of self care.
Definitely.
Absolutely. Carrie, I want to hear the bowls. I want to hear the sounds. Can you play for us?
I can. And also let you know, like, what I generally do is I'll ask the family members, or if the patient is able, I'll say, take a nice deep breath in and out. So is that okay, Helen? We can do that?
Yes, please.
Okay. So take a nice deep breath in through the nose, out through the mouth, and just connect with your heart.
When you have administered, provided a sound bath for somebody who's working as an end of life professional, an end of life
Mhm.
worker, do people typically come to you, or do you look at them and say, hey, you look like maybe you could use a sound bath? do
Yeah,
you try to do that, or do people now come to you and say, hey, I really think I could use this?
would love to do that. Say, hey, you really look like you could do this. The way we do is we have a sign up. So I sent up a sign up sheet, because we would never want to force this on anybody. And there
Right.
are people who don't believe in this. There really are. It always amazes me, but we just have a sign up, and people sign up if that's what they want to do. I usually have a lot of people that sign up, and first time people too.
these bowls and this practice like this is an ancient thing, but it's not of Western culture. It's very much Eastern culture, right? You said the bowls were
Yes.
Tibetan style. Is that right?
The ones that I use. Yeah. And we're definitely getting there in the Western world for sure. I think people are waking up and realizing that there are other things that could help us. I think they're looking for it. I've noticed that in the past year. People are just looking for something else
Yeah.
to help heal.
I think so too. I think we're sort of unlearning a lot of these medicalized ways of managing death, and we're going back. I think people are really curious about more natural, more human ways of moving through dying and through a death. And, these ancient Eastern rituals and rites, I think, are really beneficial and part of that unlearning. We're embracing some of those things.
And I love when I'll get like a referral. It'd be like, oh, this one's daughter loves Reiki or loves sound, and they can't wait for you to come out, and those are always, I love working with anybody, but those are always really special because, they already know. And I do have a situation I would love to talk about with sound, and this just happened about a month ago. Two daughters, that situation, they knew what Reiki was, they knew what sound was. I don't think they had utilized sound as much, and so they were really excited about having the doula come out and perform that. And I went out, did a session. They were very grateful. It was very beautiful. And we kind of thought that she was going to go that day, and she didn't. So they ended up getting a hold of me, and I went out. And this is that time where medicines were given. She was comfortable. Everybody had said goodbye. Everybody had said it's okay to go, right? All the typical things that we do as hospice care workers, like trying to figure out, did Uncle Sammy say goodbye? All those things.
Right.
And they're just looking at me. And so then I realized, this sound was for them, right? Not so much her, not the patient, right? So we did the session and we got done. And the one daughter looks at me and she goes, I have the feeling that I should go. And she looked at her sister and she's like, Mom doesn't want us here. Right.
So she thought that she should leave?
Right. So she got that feeling in that sound, whether it took her, to that unconscious state or, whatever. And I was like, okay, now explain to me what that looks like. And she's like, I feel like we should not be here, And that turned into a conversation of, well, Mom was a private person. And sometimes people, and this, people will wait for you to come and people will leave, right? And then, and so they had made the decision that they were going to leave that day. And she passed away at 2:00 that night.
She wanted privacy.
She did. And so, again, there's no qualitative state or, there's no way to like measure that or whatever.
Yeah.
I just can tell you it's pretty amazing.
Well, and I know we do not have the power to order the time of our deaths, but there's a lot of anecdotal evidence that says some people want solitude to die. They wait until that family's gone. His family can sit vigil. Staff can sit vigil with someone. A doula can be there with them. But when those people step out and the room is quiet and they're by themselves, that death occurs. And I think there's something to be said for someone who just is seeking solitude, or if they've been a private person, that's the way they want their death to go. It makes sense.
Yeah.
I have to tell you that I'm in the process of working on my advanced care plan. That's my goal for 2025. And I love the idea of having a sound bath as an intervention while I'm dying. That sounds incredible.
Yep.
I like it. I'll be calling you.
I was going to say, I'll come over. I'll be there. I'd be honored to be there.
I love it. Okay. Let's get a little personal. What challenges you most about working with someone at end of life?
It's changed over, I've been a nurse for 26 years, 21 of them in hospice. It's kind of changed over the years, as you step into that, like that expert. I don't know if that's what you want to call it. I think lately the challenge is more the broken healthcare system and how people are coming to hospice either way too quick when they should have came sooner,
Yeah.
or they just come with such brokenness, so many doctors, and whether they told them what's going on and they
Yeah.
heard it or they didn't.
Misinformation.
Yeah,
Yeah.
it makes it challenging. And that's okay. I love challenges, but I just feel like it's just more intense. And maybe it was COVID, I don't know. But that's probably right now the hardest thing.
Yeah. Well, and after you do this for a few years, I think that it accumulates. And I'm with you. The system is broken, and we're still supposed to provide the best care regardless of what the system is. So tell me what you love about working with folks who are dying.
It is an honor to be there when somebody takes their last breath. It is an honor to work with families and be on their journey. From sometimes not accepting to what's going on and being on that journey and being there when they get it or they don't get it. And I just honestly, I love all of it. I'm pretty sure I was put on this earth to be a hospice nurse. So, yeah.
That's pretty cool. I don't know of a lot of other professions, and I'm biased, of course, because I'm a hospice nurse as well, but who else gets to work a job like that? You're there for one of the most sacred events in a person's life.
And be there for those families after they've taken the last breath, or, and be that support person for them, or to be there when there is joy because they've seen their loved ones suffer for so long.
And there's a release to it. Yeah.
Yeah.
Absolutely. Yeah. Carrie, what's your favorite form of healthy self-care these days?
Meditation, going within, and then I'm really taking the time to enjoy life.
I like that.
I hike. That's really I love getting out and getting my feet on the ground and sun in your face, all that fun stuff.
Wonderful. Wonderful. Yeah. Okay. How can my listeners connect with you, see the work that you're doing?
They can go to my website, www.angelheartholistics.com. I'm on social media too, at Angel Heart Holistics.
I will have links to your website and your social media in the show notes so folks can find you easily. Carrie, what's one question that I didn't ask you that you would have wanted to talk about today?
I guess for me, it's kind of backtracking into like why I got into this complementary part of it, this holistic part of it. And really for me, it was COVID and working through COVID and being in hospice. And although we're used to death, the death was immense because I worked in New York. So I was looking for something to help myself, and then realized that I could turn it outwards and help my patients.
I love that. It started out as something to help you, and you share it. That's pretty amazing. Carrie, thank you so much for having this conversation. I learned a lot from you today. I really didn't know a whole lot about aromatherapy or sound bathing. My contact with that's pretty limited. I love the way you're using that in the care of your patients, and thank you for sharing all of it with me today.
Thank you so much.
Thanks for listening to the Heart of Hospice podcast. Check out our sponsor in the show notes and please leave a rating and review on Apple Podcasts. We would appreciate it if you would share this episode with your friends and family and anyone who needs to know more about hospice. Connect with us on Facebook, Instagram, and LinkedIn. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.
This is the Whole Care Network. Helping you tell your story one podcast at a time.